Back in 2011, when Governor Cuomo took office, he faced the worst budget deficit in state history. He was basically facing a $13 billion budget shortfall, and we were in the heart of the Great Recession. And in that environment, he knew that ultimately the state's biggest program, Medicaid, had to be really reformed and transformed. So we started an effort at that point to bring this program into the modern era and use it really as a force for good, for using it to really drive more systemic healthcare transformation efforts across New York State. We started with a major effort to really rein in spending, to bring down per recipient costs in a program that really had been really out of control from a spending standpoint. And we did that in our first couple of years of the initiative. So in years 2011, 2012, and really 2013, we're really focused on trying to get the Medicaid house in order. And we had tremendous success. Over a 4-year, 5-year period, we're able to reduce spending by about $16 billion. And that really set us up for the second phase of our healthcare and Medicaid transformation efforts in New York State, which was what was called the Delivery System Reform Incentive Payment Program, or DSRIP, which was an effort to really transform the healthcare system itself. What we realized during those first early years is that while we could do a lot to make the program more efficient, changing our own policies and procedures, but ultimately at the end of the day, Medicaid is but one payer among many buying from an inefficient healthcare system in New York State. And that if we really wanted to get the best outcomes for the roughly 7 million people in the Medicaid program in our state, we really had to go even further and really try to drive the delivery system itself to a more cost-effective plane. And that's really what DSRIP was all about. And it led to the creation of 25 performing provider systems and aggregation of providers all across the state who came together in common cause to improve outcomes and lower costs. That initiative has proven massively successful. We're well on our way to reducing avoidable hospital use, the core measure of the initiative, by 25% over a 5-year period. And we've improved outcomes in a wide array of ways across the entire state. The initiative is now being looked at not only across the country but around the world as an inspiration for what healthcare systems should be like in the future. After that, we moved on to even a more fundamental and structural change in the healthcare system in New York State. While DSRIP got a lot of focus because it was an $8 billion investment into the healthcare system in New York, it pales in comparison to the changes that came about by the move to what was called value-based payment. Value-based payment is really about changing the fundamental economics of healthcare to really incentivize better outcomes from all providers of all types across the entire state. Really, at its core, value-based payment is paying for results, not paying for services, not paying for units and widgets, but really paying for better outcomes and services that matter to people and communities. And that transformation is now also well on its way. Over 50% of total reimbursement to providers in New York State is now value-based, thanks to Medicaid taking on this major leadership role. It's really, I think, ultimately going to lead to a more cost-effective system, a system in which the patient and the community really is at the center, and providers are working together and constantly innovating in ways that lead to better outcomes and lower costs. That's really the holistic story. It's not over yet, still lots of work to be done in New York healthcare, but I think the state is well on its way to having what we believe ultimately be one of the most cost-effective healthcare systems in the country.